I would now like to welcome a guest of honor, Honorable Dr. Vedprakash Mishra ji. He is a well-recognized figure in the field of education in our country. Sir is a BC Roy awardee, Pro-Chancellor Datta Meghe Institute of Medical Sciences. Sir is on the boards of management of various universities across the length and breadth of the country. An orator par excellence who has an ability to keep his audience enthralled. He is known for his wonderful administration and high academic achievements. He is a reckoning force on health planning and education research in the country. If I am to attempt to list all his affiliations and achievements, the day will definitely run out. So without much ado, I would like to humbly invite Sir to please say a few words.
Thank you for your kind liberal words. I join all my previous speakers in complimenting and extending very warm wishes of the 75th Independence Day to all my learned brothers and sisters. Respected Sindhutai, respected Sagarji, seated on the dais, respected Maitriji, my esteemed learned brother, Dr. Satish Devpujari, Madam Mukherjee, Madam Radha. I see very respectable faces across me, respected Kamaltai, and the two innovators, Dr. Anupma, along with Manishji, their entire team, ladies and gentlemen. Dr. Anupma and Manishji really deserve all kudos, all compliments for the imaginative innovation that they have worked out so diligently. And the same having been credited not only to the fond memory of late Dr. Bhutte, but being named after the inspiring mother, Sindhutai, which perhaps narrates the entire story, what perhaps the cultural tradition Dr. Maitri was referring to. There cannot be a better moment of pride for a devoted mother to be instilling inquisition in the mind of a child. That innovation finding its own culverts, finding its own imagination, getting worked up with their own essence of integration, blending all together, shaking hands with the technological experts, and coming out with a monumental creation, which perhaps is more baffling than any other thing. Dr. Anupma, I do not take this to be a small stride. I'm really tempted to quote when Neil Armstrong put his feet on the moon for the first time. He very categorically made a statement. This could be a small step of a man, but it will be a giant leap for the mankind. This is exactly the innovation that you have worked out. The other day when I was talking to her in my residential office, I was just contemplating the narrated events put across by Anupma. The journey of colposcope is no different than what you are trying to tell today. 9th of October, 1925. Hans Hisselmann was the German physician who worked out of two small Latin words. Kolpos basically means hollow, and scopos means to light at for the purposes of visualization. And that's exactly the entire dictum of the Latin integration of the two words, made him to go in for peeping a hollow cavity for the purposes of identification and laying hands on in regard to through the essence of illumination. And therefore, colposcope as a visual tool that it began with. First World War took its toll. It could not gain credence in UK till 1957. The historic paper, which was put in by British Journal of Obstetrics and Gynecology by Al-Yusuf, who gave the entire narration of the colposcope, as a result of which it became acceptable to the Western world, including Europe. Believe me, ladies and gentlemen, the dimensions of innovation in the domain of interventions, they have not been that rapid. The inter-observer variability, ladies and gentlemen, came to be answered as late or as early as 1980 in case of colposcopy, when Reed's interpretative index or colposcopic index came into operation. After that, the mechanization was there. But the digital colposcopy, which was to be incorporated, and in that digital colposcopy, the blending of the artificial intelligence in the form of an algorithm perhaps turns out to be a milestone in its own right, and that's exactly what you're trying to achieve. Therefore, a journey which began on 9th of October 1925, perhaps wanted to be scripted in the essence of a historical presentation in terms of 15th of August 2021. And in that voyage, which Hans Hinzelmann began, a story was further required to be scripted by Anupma along with Panish, and they have done it. This is a journey and this is a transition which is epoch-making in its own way. 2 or 3 small little things which I would definitely like to advocate. Portability, one issue. Visualization, second issue. Cost effectivity, third issue. They have been tackled and they have been answered. There will be certain areas which we will be required to be putting across to answer. Whenever we contemplate a device, the specificity and sensitivity of the device in terms of the regression analysis turns out to be one of the important landmarks that needs to be worked up, and that should be worked up is my proposition, which I would like to put across to her. I was just talking to Sagarji that she is a doctoral scholar registered for the doctoral program with our university. I would like to advocate this topic itself to be her doctoral topic. Assessment of sensitivity and specificity of SinDiColpo in the context of its correlation with histopathological correlates, whereby the sensitivity and specificity you will be in a position to document in its own right. And that will be the real authentication of validity in the context of utilization of the instrument. Therefore, I am taking the privilege of being the pro-chancellor of the university to be declaring a doctoral topic for the doctoral scholar in my university. The third important aspect which I would like to highlight, ladies and gentlemen, is when we are wanting to make a difference in the entire healthcare scenario, it is the reach which is required to be extended. And that reach cannot be only out of an imaginative charity. That reach has to be absolutely blended with accuracy and authenticity. And then only it goes to make a difference. It's in this context, the merger of the digital colposcopy with the algorithm in the context of artificial intelligence, where the inputs broadening in terms of the observed reality is being fed into, and the level of accuracy that the artificial intelligence algorithm will be in a position to generate for itself will be something which will be adding to the diagnostic accuracy. Screening by itself mandates that, and very rightly put in. Ultimately, when we are availing the artificial intelligence for the interpretation, it is only the images which are required to be fed up, and the interpretation can be worked out in the form of tele-interpretation, which turns out to be the handy modality and handy tool. These are the advents and the lesson which we as community of doctors need to learn, ladies and gentlemen, is ultimately our imagination and inquisitions have limitations. We still do not have the technological understanding and interface. And it is an integration, handshaking between the medical world and the technological world. It is an integration between an engineering world, a technological world, the management world, and the medical world, which ultimately will be a hallmark of innovation. This trend to that effect from Indian context, I believe, has been set in. The advocacy which has been put across by Satish Dev Pujari requires to be understood in the spirit of it. We still have not been able to interdigitate ourselves with technology in the real essence. Our dependence has been too heavy. And therefore, ladies and gentlemen, it is that integration, it is that handshake, it is that joint working, it is that interdisciplinary integration, it is that bioengineering domain, which ultimately is expected to be the hallmark on that count. Germany set up that trend. Western world has moved far ahead, and perhaps we are still lagging and lurking behind. We still think that it is the Western minds which are required with certifying things for us. Then only they will become of relevance and use to us. Trends need to be reversed. And therefore, this open-ended interdigitation between biological sciences and technological sciences, as a result of which the manifestation of SinDiColpo by itself is one of the monumental examples. I trust and believe that this should be a wider vista for us to operate on. In my own university, with the patronage of Shri Sagarji, we have already worked out a center of excellence on artificial intelligence and data management system, of which the honorary director is Satish Dev Pujari. The main mandate that we have vested with that, and we would like to be working with that, is especially in this particular domain of integration between technology and medical sciences. And as rightly put in by Shri Maitriji, that let Nagpur be a pioneering focus point on that. In this dimension, the patronage which has been rendered by Sagarji Meghe on that count is monumental. And therefore, I would like to record on behalf of the scientific and thinking community of the city of Nagpur to be grateful to him for that particular patronage which has been rendered. Our university is venturing in that direction, and maybe the center of excellence that we have contemplated with Dr. Satish Dev Pujari as the honorary director there too will definitely be a milestone in that particular direction. However, I deem it inevitable that the way Anupma has really made all of us proud of her creativity. That creativity, which is a sense of ingenuity. That creativity, which is a hallmark of out-of-box thinking. And that creativity, which is not only an out-of-imaginative box thinking, but with a sense of social responsibility and accountability of extending the reach of the healthcare to the poorest of the poor, remotest of the remote, weakest of the weak, in a real, meaningful, humanitarian sense. There cannot be a better proposition than that. Humanization at one end and socialization at the other end of creativity and innovation turns out to be the way forward. I think Anupma is a torchbearer on that. She needs to be saluted for that. And really, the gratitude that we would like to ventilate on is monumental. I compliment her, Shri Manish ji, and her entire team for this devoted pursuit. And I'm sure that this would be one of a trend that she has set in. Let this trend be inculcated by young minds, all of us keenly onto that particular count, so that we make a real difference in the healthcare scenario. Thank you very much for patient listening. God bless you all.
Thank you so much, sir, for wonderful words of appreciation and encouragement.